What's up, Alphas? It's your boy, Alphas May, the moderator. And y'all know I'm here with the beautiful, amazing, always here, the best host.
Bree,
and we got a special guest today, Dr. Jessica Thompson.
Yeah, woo, woo.
Physical therapist, host of a podcast, Core for Momentum. How you doing today, Dr. Jessica?
Oh,
Doctor.
You could just call me Jessica. I'm doing
Put some
great.
respect on my girl name, Doctor.
I'm doing great. Thanks for having me.
No problem. We happy to have you here. You're giving us insight today. But before we get started on that, I got two questions. I'm gonna hand it over to my beautiful co-host. First question is, tell us a little about yourself. People that don't know you, tell us where you're from, a little bit about yourself, degrees, education, why we call you doctor.
Oh, okay. I am from Charleston, Mississippi, super small town in North Mississippi. I went to undergrad at the University of Southern Mississippi. I got my bachelor's in kinesiotherapy. I lived in Memphis for about a year where I was a tech at an outpatient physical therapy clinic that specialized in pelvic health. And then I went to Mercer University to get my doctorate in physical therapy. And so now I'm an orthopedic physical therapist, but I also specialize in pelvic health. And I live in Atlanta, Georgia now.
Okay, shout out to the ATL, shout out to Southern Miss to the top.
Shout out to
Yes,
Southern
to the top.
The viewers gonna be like, I'm tired of hearing about Southern Miss. Y'all gonna hear about it forever.
Nobody care. Nobody care.
You got 3 Southern Miss grades. You're gonna have to deal with it.
That's right.
But for the people, most people know what physical therapy is. But for the one person who does not know what you do for a living or has never experienced it, what is physical therapy?
I like to say that physical therapists, muscle is our organ. So if you think about it, like you go to a intestinal doctor or whatever, you go to a physical therapist, usually like we specialize in muscle. We also treat like neuromuscular issues, musculoskeletal issues, cardiopulmonary and integumentary issues. So we actually do a lot more than what people think, but exercise is our medicine. We specialize in movement. We are rehabilitative discipline, but we also do a lot of work for prevention as well. And I think that's the piece that a lot of people don't know about. So you can come to see us even if you're not injured or in pain, if you want to prevent injuries, or if you need guidance with like fitness and wellness. We do those things as well.
Okay, I'm gonna hand it over to my beautiful host, Bree.
Okay, so speaking on physical therapy, tell us about your journey through how you decided to go to PT school, what made you want to be a physical therapist, and how that journey was up to being Dr. Jessica.
This is so interesting. So my mom is a nurse, and she basically told me I kind of had to do something in healthcare just for job security. So I'm like, okay, I know I want to be in the healthcare field, but I've always been passionate about health and having people be more advocates for themselves as far as their healthcare goes. So that was cool, but I didn't know what I wanted to do. I knew I didn't want to be a nurse. I didn't want to be like a medical doctor because I'm not really just into medicine like that. And so I was a cheerleader in high school, and my cheer coach kind of told me a little bit about physical therapy. Like I said, I'm from a really small town. There were like no outpatient physical therapy clinics in my town. I never saw it, but she told me about it, and I did my research, and I thought that would be something that I would want to do. So initially I wanted to work with athletes. But so that's why I kind of chose the kinesiotherapy major at USM, because I knew it kind of related to physical therapy the most out of all the other majors at USM. And so from there, I just kept getting affirmations like, okay, physical therapy is I'm interested in this type of stuff, so it's cool. Me and Brianna had an internship together back in the Gap, working with patients with spinal cord injuries in Memphis, and we worked really closely with physical therapists through that experience. And so there was more of an affirmation for me to keep doing that. And then once I got the job as a tech in an outpatient clinic, I thought it was just going to be a regular outpatient ortho clinic. But when she told me, she was like, I think you'll be great for this like special role at our specialty clinic, which happened to be pelvic health. And I was like, what's that? Never heard of pelvic health. Like, what do PTs do, down there? But I needed a job. So I was like, okay, I'll do it. And so just working that job every day and seeing how the physical therapist made an impact on the women and the men's lives that they treated, I was like, okay, I'm definitely in to do this PT thing. And I definitely also want to specialize in pelvic health one day. So that's just been my journey so far.
So speaking of pelvic health, because a lot of people might not understand exactly what that is, can you tell us what pelvic health is and how that relates to physical therapy?
Yeah, so I mean, as far as physical therapists go and like what we learn in school, like we learn about all the muscles, all the joints of the body. But pelvic health is just a unique discipline because actually in PT school, in most PT schools, you don't learn much about the pelvis and the pelvic floor muscles. So if you are interested in that, you have to do a lot of education on your own, like after PT school, and search for that. But what pelvic floor physical therapy is basically we treat the muscles like we do any other muscle of the body, like your bicep, your quads, whatever. If it's a weak muscle, we try to strengthen it. If it's a tight muscle, we try to relax it, basically in its simplest form. But a lot of the things that pelvic health PTs treat are like incontinence, which is basically involuntary leakage of some sort. It can be urine, it could be feces, pain. A lot of people have pain and chronic pelvic pain, and a lot of the times it is related to muscles. So we do assessments to kind of figure out where the ailment lies and like how we can treat that for women and men. But a lot of times with women who have pain with like penetrative sex, we kind of treat that because a lot of times that is also related to muscles and muscle spasms. So we can treat that as well. Or, women who just have like pain with like pelvic exams or pain with inserting tampons, all of that can be muscle related. And so we do our exams and kind of figure out what's going on and treat just like we would treat any other part of the body. It's the only reason why it seems weird is because these are muscles and areas of the body that are like taboo and people don't want to talk about, but it really shouldn't be.
It should, you know what? It really shouldn't be, because people need to know that to be your whole self, you need to be able to work all of the muscles that you have, and that includes those are very important to your whole body. So that it is important. And I know I didn't learn about pelvic health until you started doing it. So I was like, I didn't even know this was a thing. Like, this is a real thing. Like, so just to give y'all a little background on me and Jessica, on how, I became to know such Dr. Thompson. Okay. Of course, we went to USM together. We went through the same program for kinesiotherapy. And we ended up doing our internship together in Memphis. So we were roommates. And we did it at the VA. And it's crazy how both of us kind of found our way in that internship. Like, I realized that I don't want to be in this clinic. Like, I want to work on the other side. I don't want to do this. Like, I want to be behind the desk telling people what to do. And Jessica realized that she wanted to, still be hands-on in the clinical setting and being a physical therapist. So that right there, like, shows you, like, we went through the same program. We was walking down the same path, and I was like, nope, this is it for me. I am done. I'm going to the other side. But ever since then, we kind of been inseparable. We lived together in Memphis even after we finished school, and then she went off to Atlanta, and I stayed in Mississippi. And now we both live in Georgia, so we're not that far from each other. One of my favorite people in the world. So I wanted to be able to connect those dots because it's very important. The connections that you make with people become lifelong. Mm-hmm. And again, like I would have never known about pelvic health if it weren't for Jessica. I would have not had any idea that you can even go to physical therapy and do anything like that. So it's it was very informative, and it's very important to know, especially for a woman or a man, like just knowing that you can be on both sides, which is also very, very important. It's not just for women. So what are some of like the key or important things that you teach your patients or your clients about their pelvic health, even if it's preventative or just being more comfortable, not with it not being a taboo, being able to express that type of situation?
That's a hard question because it depends. It's like a case-by-case basis. Like, I have people who are super excited about it, and like they call me before their visit and tell me exactly everything, every detail, what's going on. Like, this hurts. I don't feel the same down here. When I do this, it doesn't feel the same. I need help. And then I also have people literally that I'm treating now. It might be, I don't know, maybe I've treated them 10 or so visits, and I still cannot like use those like genital terms with them, or they still don't feel comfortable with me assessing them manually with my hands. So I have to instruct them to do things at home on their own because they're just not comfortable with it, which is totally fine. But it's a spectrum, and it's my job to make people feel comfortable and like build rapport with people starting, on our first encounter. And sometimes that is effective and sometimes it's not. Like the person I'm thinking about who is still like uncomfortable with things, I didn't evaluate him at first. He went to another clinic and then he was referred to me. So maybe that's a part of it, but it definitely starts from day one. And the first visit it's usually more talking than physical assessment anyway. And there's a lot of education about it as well. Just teaching people like the terms of the things down there. And so they can better explain like where they're having the pain or the discomfort or the dysfunction. So we can go from there. So it's a lot of education. It's a lot of me listening. Pelvic health is it's a realm of PT that is it's sensitive, and you got a lot of psychosocial components around it. So you just have to be aware of that at all times and make people feel comfortable, just so they can trust you and, so that you can serve them better. But it is difficult. And honestly, I think that for me, I've had better experiences with like people being open when I guess they feel like they can relate to me. So like treating moms who are like around my age, and also female, so it's like we can relate. They can just be honest with me. But if I'm treating an older lady with urinary incontinence, this is a big age game. She's like, you don't know what I'm going on. You don't know what I got going on down here. So
right.
It's it's more of a disconnect there. And then with treating men, and I'm this like young bubbly girl, and they're having pain with sex. Like they don't want to tell me that sometimes. But
that's true.
Yeah, but you also have some guys that are like I don't even have to treat them in a private treatment room. They just like, this is what's going on. Help me.
I need help
so,
right now.
It's a case-by-case basis, but it's fun, and it definitely helps me grow, like, my just, like, interpersonal and interviewing skills a lot.
That's good. So you talked about education. So you now have a podcast, right? So can you tell us about that podcast? Tell us where they can find the podcast, the things that you talk about, and the different people that you have on that podcast?
Yeah, so it's a podcast that I'm a part of, but it's a group of like pelvic health PTs that, we kind of bounce off each other. Sometimes I interview, sometimes they interview, sometimes we interview each other. But it's called Core 4 Momentum. It's Core, the number 4 Momentum. And it started from like a private Facebook group where for women, for whenever they had questions about like postpartum related issues or just any type of pelvic floor dysfunction. Like it was kind of like a question and answer type thing, but we also dropped like educational videos and stuff like that. And it's still a private Facebook group if anybody wants to join, Core 4 Momentum. But it started from there, and then we just decided we wanted to reach more people. So we decided to make a podcast, and it started like mid last year, and we're going to start posting content again tomorrow. I'll be posting something tomorrow. But we've interviewed women who've had like home births to talk about their experiences. We've interviewed other pelvic health PTs to talk about like what is pelvic health PT, what can patients expect on their first visit. We've interviewed like exercise science specialists who kind of specialize in working with women who want to, keep fit and keep doing their strength training while pregnant. That was a really popular episode. And other PTs talking about urinary incontinence and things like that. So I interviewed someone about C-sections and how PTs play a role in like scar mobilization and just treatment after C-section and vaginal births as well. But so we kind of like, it's a lot of different things like mixed in. It's really focusing on women's health right now and pelvic health, but we're going to try to mix in more content, just educational overall, like health content as well. But it's been fun. It definitely got me out of my comfort zone, honey, but I learned each time. And this season, you can expect to hear from other PTs, like I said, other professionals that are kind of like outside of healthcare. Planning on interviewing some sex therapists and other cool things. So stay tuned.
I'm excited. I'm excited about this because, again, this is like a whole new world for me. And so learning about all of this, I'm like, I didn't even know that this was a thing. So, like, it's very, very exciting to learn about. And Trevor, you're going to have to start watching the podcast because I know how you and Unico and Wes like to talk about all this stuff. And I need y'all to learn it and be professional about it. So when y'all get on here and do y'all man talk, y'all can talk about it. And y'all know what to say properly. Okay?
Respectfully.
Properly, okay. Respectfully, okay.
Respectfully.
By the way, her information will be in the description, so go down there, hit that subscribe button there. Don't forget to hit that subscribe button to us. Hit that follow button too for both podcasts too. So
yes. And I got one last question. Here on Purpose, we talk about being your whole self. We always try to encourage people to go after what they believe in, find their purpose, work in their full purpose. So there aren't a lot of Black health professionals in the world. So you are a Black doctor. Actually, let's just make sure we keep saying that so y'all understand what's going on, okay? You are a Black doctor, health professional. So for those people who are thinking about going to PT school, who are currently in, any type of health profession, what advice do you have for them based on what you would have wanted to hear when you were going through?
That's a good one. I do want to say, just drop a stat out there that right now, about 5% of practicing PTs are Black and about 3% of PT students are Black. So we are a very, very, very small group within a small group. And I know for me personally, when I was looking to apply for PT schools, I would get discouraged when I would go and look at like class, like graduation photos, and like I'm trying to find that one Black person. So I would say, don't let, you being a minority stop you from going after your dream. Sometimes somebody has to be the first, or,
right.
Somebody has to be one of few, and that's okay. I would say, if you're looking to get into healthcare, like do all your research into all the different healthcare professions and find the right one for you. Think about your passion, but also think about finance and how expensive schools are. Search for those scholarships. The National Association of Black Physical Therapists, they have chapters in different states. And if anybody's listening wants to learn more about physical therapy, you can follow them. You can find their website. They give scholarships to prospective students and PT students. So that's something to look into. But never let being a minority stop you from following your dreams. And don't feel like just because there's nobody that looks like you in the classroom that you won't fit in or that you don't belong, because you do. I definitely had days. My class was unique. I actually had 6 other Black people in my physical therapy class, but that still didn't stop me from thinking that I was less worthy sometimes of being in that same position as my non-Black peers. And I should not have felt that way. So never go into a situation feeling like you're not worthy or that you have to prove your worth to be in a position, because if you got there just like the rest of them. You
Yes, you
belong there. And be confident and disciplined throughout your journey. And you can literally do whatever you put your mind to.
Period.
Big that.
Trevor, do you have anything else?
Yeah, based on that question about Black people, African American health, and we know that often African Americans don't trust therapy, doctors, medicine, the whole thing. We see that with the coronavirus vaccine. We are not taking it much at all compared to other people. How often do you come across African American woman or male who might be more uncomfortable and not share about what you do, and if they want to, how much they open up to you?
Let's make this personal. I will talk about this from my job that I have now. Whenever I go to the front, if I have a new patient, I introduce myself. I always introduce myself as a doctor of physical therapy, because people don't know that physical therapists have doctorate degrees now. And for 2, I want them to kind of trust that I'm educated and that I'm there to help them. But when I go up front and I see the person, if the person is a Black person, a lot of times like I see like a light shine in their eyes, right? And I don't want to say I automatically get their trust, because I don't, and I shouldn't. Just because I'm Black, you shouldn't trust me because you're Black. But I think it's refreshing for people to have healthcare professionals that they can relate to and that they feel like will listen to them, and they know their story, or they have like similar struggles, honestly. And it's refreshing for me to, treat those people like I would treat my loved ones, which I treat all my patients that way. But I want to give Black people the quality care that they deserve and that they oftentimes don't get, right? But on the flip side of that, when there's a patient who, for me, most of my I don't want to say difficult patients, but most of the patients that I have difficulty building rapport with are older, white, and male. That's just my experience. And, because like I said, this little Black, small, young, bubbly girl goes up there and I introduce myself as a doctor of physical therapy. Like sometimes they barely want to make eye contact with me. But you can tell that they weren't expecting to see me. You know what I mean? And it's like, because people have expectations before they go to any doctor's office. And I know from that first encounter, I can tell if someone is like disappointed or like shocked or like not expecting to see me, or not happy to see me, because, maybe they would rather be with an older white male PT. They may trust them more just because it's somebody that they can relate to, or because they usually have other healthcare providers who, fit that role or that persona, and I don't at all. So, and I never try to be somebody that I'm not. And I'm really good with building rapport with people, but I don't ever force it. And sometimes that first visit is really awkward, and then after a while, they realize I'm not gonna change, and I'm still gonna treat them the way I would treat anybody else, and then they grow to love me, or at least to tolerate and respect me.
Okay. I know I'm all about black girl magic. That's what we out here for. Got so
Yes.
we out. So I know mother should talk crazy, but y'all love me. But but when you say that, I think about how in a and it's about society, how 2020 happened in 2021, how things happen. I just want to know well, not necessarily your profession, but when you think about how we want more black people in your specialist degree or physical therapy or more black doctors or more black teachers. I think the main part, we don't really have hardly any black male teachers, and black little boys shine. Like, I notice when they do that with my brother, they like, Mr. Chase. So I know how excited they get to see one black male, even in the facility, even though he's not a teacher.
Mm-hmm.
So what are your thoughts on how should we encourage more of that and more of that talk, and with black women, black men, to motivate to be in more fields, in the fields that society seems to tell us we have to be in to succeed?
Yeah, I think that's really important. I agree. There is a lot of like black girl magic going on, and we are doing a very good job of empowering each other and representing. Like when we do something, a lot of times we like to be seen and to encourage other black women that they can do it too. But on the flip side, I feel like I think men could do more. I think the men that are in these roles, these leadership roles, these roles in healthcare and education, we need more of them to step up and to, you know, show and be represented and to show other men that they can do it as well. Because, you know, I talk about the 3% of PT students are black and 5% of clinicians, PT clinicians are black, but it's like literally 1% are men. So even in that statistics, it's more women, black women PTs and PT students than men. And I mean, I wish I knew why. Like, I don't really know, but I think that just as a black community, we need to show our black boys that they can do anything and be anything as well. And I don't know. I guess we dropped the ball on that, but I know for me, because I am about women's empowerment, but a lot of times I take a step back from that and try to just empower anybody or anybody that's black, because I don't want to leave the men out of the situation because they're important too. But yeah, I think more men should step up, because in my personal life, even when I'm talking to a black man and I'm trying to encourage them, I can say something, but Zelma, if you go to that same black man and you say it, they're gonna receive it differently. And I don't know why, but that's just how it is. You know, people, I guess it's just like I've been talking about this whole time, you know, seeing somebody that kind of like you and you relate to them more, you listen to them more and you value what they say more. And that's just, I don't know, and Bree agreeing with me, like a man, when they hear, because women, we always know what's best for y'all most of the time.
Y'all
but,
just need to listen to
but if a man tells you the same thing, it's like you'll remember every word he said.
And you'll hang on to it. You'll never forget.
Yeah. So we just need more men to step up. And when you do, it's not like the women won't be behind you and supporting you. I know I will. But I can't relate to men as well as other men can relate to men.
And I think that's an important factor to the answer to the question. The men that get there have to remember, like, I need to go back. Because women do it all the time. When I get to a place, women be like, I'm going to push you as I go. But when I get there, I'm going to bring you with me. And I think that black men have to be able to do the same thing. To have a black man that is a black professional, whether that's in healthcare or in the corporate world, to be able to look back and go to those young men and be like, you can do this. Like, I came out the hood just like you can do this, and like hang on to them. Don't just tell them just because you think it's the right thing to do, but to actually create that relationship with those young men and hang on to them and like mentor them up to be where you are. And I know that it takes a special gift to mentor children. Mm-hmm. For sure. But at the same time, if I'm a black professional and I'm a man and I know how hard it was to get here, I should be able to, that's something that I should be able to put back into the young men to know, like, you don't got to take the route of being in the streets or being a rapper, because you can't rap. And I feel like I hadn't said that this year, because I say this often. You can't. You don't have to be a rapper, because you can't. Like, you can't rap. Like, and you don't know, you can't be a producer because you're not an engineer. Like, I feel like that's my first time this year saying that on purpose. And I just want to make sure y'all know that everybody not a rapper. Okay? It's okay to be a Black professional, and it's not going to take away your masculinity.
Or, you know, your street cred, or, you know, your hood reputation. It won't.
After 5 o'clock, you can go back to doing that, but from 8 to 5, we need you to be representing. Okay, we need representation matters, and we need y'all in those spaces.
Yeah, because I think at this point in the Black community, especially in the young Black community, when it comes down to males, we have more representation as, you know, the rappers,
scammers,
the scammers. What's it called? Like the street pharmacists and stuff. Yeah, stuff. But we got a lot of representation of that, and I think as a young Black boy looking for somebody you can relate to, right? If all the men in your life that you can relate to, if those are the things that they're doing, and you know, whatever it is, maybe if legal or illegal, you know, if they're successful at it, you're thinking as a young Black male, you know, these are your role models. There's a lot of times what you imitate. So that's why we need more of the professional young Black men, the Black men who are finding legal ways to be successful and to impact the world. We need y'all to really shine your light so that these men can see, like, I can imitate you. Like, you can be my role model.
Yeah, for sure. And be okay and be comfortable doing it.
Mm-hmm.
Yeah, one thing, something amazing is a mentorship for anybody really, but most of I made it for young Black men. COVID kind of shut down my NASA plans when I was going to try to put a lot of people in Jackson in a NASA program, but we might have it still back up this summer. I'm co-doing it with, shout out to Corey. Some of y'all know him from Keeping That Now when we did the Star series we was on. But yeah, we got that going on. And like y'all said, most people see the successful people as rappers and they in the music industry or they're athletes. And the thing about those people, are they competing? So you don't see the love. Like you'll see Deshaun Watson trying to beat Lamar Jackson, but you don't see Lamar Jackson giving to his charity as much on the television or on the screen. Or Deshaun Watson, I know he just paid off a school. I know the Black principal just worked the extra job
to pay for everything.
Yeah. So, and these are not advertised as much as the guy in the club throwing hundreds.
Especially because of social media. So.
Yeah.
Exactly.
So that's one thing we got to start doing as mentors and everything else, is that it's not about, you won't have to have the highest paying job, because that's a dog eat dog world. And people really don't help each other, or they looking just for favors in that world. Like, oh, you help me, you look out for me, I look out for you, and that's how it goes. And everybody else just, y'all trying to undercut my bottom line. So in those situations, so we do need more mentors. I agree with that. Bree,
y'all come up with something amazing so y'all can be mentors to these Black boys now. Okay, get it together.
Oh, call to action.
Appreciate it.
Yeah, gonna be out here. Hopefully y'all learn some dope NASA tricks and y'all start being astronauts. Let's go. Get more Black astronauts out here working for.
We need more Black everything. I want to see us everywhere.
And by the way, when I say something amazing, it's for everybody. It's not just gonna be for Black kids. It's for anyone, because I mentor kids anyway, and whether it's streaming or, like I said, we got another podcast I'm mentoring that ain't out yet, so I don't want to advertise it till it's out. But I'm helping the youth from Tougaloo. I'm helping Tougaloo mentor some of their youth from their little high school program. 2 very smart kids. So hopefully that'll be out soon, and they send me anything. Y'all will hear about it on Purpose and What's New 99, so y'all get to see the youth. So everything gonna be good. Dr. Thompson, we have been happy to have you. Any other thoughts? Anything you want to get out? Want to let the people know? Your ads, your social media?
I am on Instagram. My professional page is Dr. JT. It's DRJT the Pelvic PT. And I use that page to drop educational content about pelvic health and what pelvic health PTs do. If you are somebody who is listening who realizes you might be having some type of pelvic floor dysfunction or pelvic pain, you can go to pelvicrehab.com to kind of see if you can find a pelvic floor physical therapist in your area. But if you can't find one, you can message me on Instagram, and I'll be happy to help you in any way, shape, or form, because leaking is not normal even after you have a baby. Sex should never be painful for anyone, and penetrative sex is not the only type of sex or pleasure. I just want to put that out there because it didn't come up. And you don't have to live with pain in any area of your body, especially your pelvis, and don't feel like you're alone and you can't talk to anybody about pelvic pain, because there are a lot of healthcare providers who want to help you, and pelvic health physical therapists are one of them.
Okay, thank you, Dr. Thompson. Y'all follow her. All her stuff will be in the description. Hit that like button, hit that subscribe button. Follow her on her podcast. It'll also be in the description. And we enjoyed you. Amazing podcast, amazing talk. And remember, y'all, keep stomping. Bree, any last word?
Drink your water, mind your business.
And remember, today of all days, something amazing can happen. Peace.